starting tomorrow, as another measure to further increase safety for both our employees and for the public at large, we've just decided to go free fare, if you will, for the month of April. It'll further social distancing, even less need to go to a fare box. It's faster on, faster off. People can separate, and we just overall, safety is always our number one priority. And we think that's another added benefit that we can do to keep our community safer during this period. Less, there's obviously, it takes cash away, it takes someone taking their phone out and they're touching their phone, then they're touching the bus. It's less touching all over, if you will, for the components of the bus, which just helps people get on faster. They separate inside the vehicle. Inside the vehicle, we have signs that we put up to encourage people not to sit next to each other and to separate. We've also done a significant enhanced cleaning program that we started weeks and weeks ago. And just last week, we hired a large group of temporary staff that are actually at key locations across the city, wiping down vehicles to provide even an extra layer of enhanced cleaning. So we're doing everything we can all day long, both for our frontline staff and for all those men and women out there that are, really doing the jobs that are keeping the city going, whether it's working at a grocery store, a pharmacy, or a hospital that we all are counting on right now. Oh, 100%. This will be the only time you hear a transit CEO say this, but please, we do not want you on transit. The only people we want on transit, and this has got to be very clear, is for essential trips only. So please follow the stay home, work at home, stay safe directive. It is imperative that we flatten the curve as a community. CapMetro will stay open. We are an essential service, critical service to really get, again, those people that work at grocery stores and the pharmacies and healthcare, and also individuals that have to go and shop and get to places like healthcare and groceries. So we are there, but last thing we are doing is trying to encourage more people. One day, CapMetro is going to be back open. We're going to open our arms up wide, and we're going to want a lot of people back on the system. We were recording 17 months of straight ridership growth, and we know that our system demands will be there when our community is ready. But for now, we really want people to just stay at home. And the more we stay at home, the more we're going to get faster out to work and be with each other again. Yeah, so just on Monday, we implemented a modified schedule. That was the second version of a modified schedule, and we're doing that very strategically. We know this is not like some people. I think of this as like an ice storm for a couple days. We understand this is a multi-month situation, so we want to make sure again, our employees' safety is paramount. So we're going to be able to have people that are potentially sick or a more vulnerable group to not be at work. We can still have a workforce all of April, all of May to get through this. So we want to provide that essential service. So we think the schedule we have today will allow us to staff responsibly and still provide that critical service to our community. And we're a microcosm of the rest of the city and the rest of society. So again, we are doing everything we can to look after our frontline staff, and I think they're being very courageous. They're out there. They show up to work. They understand they're here to serve their community. I'm incredibly proud of them, And I hope the community sees that, what they are doing, just like all the individuals that work in grocery stores, first responders, and of course, the brave nurses, doctors, med techs, cleaners, all those people ultimately on the front line looking after us all. So, this is what brings out the best in the city, right? When you're at a crisis, and the people that stand up and really show what they're made of, and look after each other. So listen, our number one priority obviously is dealing with this situation, and safety of not only our staff, our customers, but the whole community is our number one priority. With that said, this plan has been years in the making, probably 20 years this community's been talking about a version of Project Connect. It's been 2 years of extensive community engagement. We still feel very confident in the plan. The community feels really invested in that plan. So we are still continuing with the technical work needed. And, our job is to provide ultimately a technical program. And then at the right time, policymakers will determine how that program moves forward. But, again, priority number one is our current situation. But when this is all over, it's not going to change the underlying components that up until 2 months ago, the number one thing people in Austin were going to talk about was traffic inequities, which I think this pandemic has exposed even more, jobs, and the environment. So at the end of the day, communities are going to continue to invest in the infrastructure that helps be a healthier, connected, sustainable city. And so, we'll deal with that when it's the appropriate time. It is, and it's hard for a lot of people in our industry to obviously say that, because our job on a day-to-day basis is to move people, and we are like the life, the blood flowing around the city, if you will, that keeps people connected. And I just want people to really realize that we're there for you for essential trips, but we ask you to stay home, stay off the service, and the more we double down as a community on that, the faster we can get back to being a well-connected, fun, exciting, dynamic city. That's why we all love it here. And so we ought to bear down, get through this together. We all are in this together, and be responsible and be respectful. I want people at home to really think about it. The more you stay at home, the more you're protecting the people like my bus operators that are out there doing the job that they have to do, and the nurses and doctors. As a group in our city, we want people to be a little more, show a little more less selfishness and more selflessness. And I think if we do that, we're going to be a much better community in the end.